Just real quickly, we're going to go over our housekeeping. So just a quick reminder, this webinar is recorded. The email that you use to register for this webinar, that's where you'll get the slides and the video. You'll get that after today, as well as just the questions and answers that we have at the end of the discussion, which will be like the last 15 minutes of the webinar. The video will be uploaded to our YouTube channel as well. That's at the National Coalition for Homeless Veterans. Also, all the past webinars and other content lives there. That'll be uploaded as soon as we're able to wrap up here today. The chat will be disabled. So if you do want to interact with our presenters today, the window to do that will be during our Q&A portion. So if you notice somewhere on your screen, there's a little box with a question inside of it. That's what you'll be using to submit a question to our panel. It looks like we have a pretty good number of folks in here now. So just wanted to, again, welcome everyone to our webinar on supporting military service members in their transition to civilian life. My name is Jay. I'm the program associate for the National Coalition for Homeless Veterans, where it's our mission to end veteran homelessness. Today's conversation will dive into early interventions to support members of our military to gain access to critical services to prevent homelessness. We'll cover programs and partnerships that focus on long-term stability over the course of their new post-military chapter, including connection to housing and employment opportunities. Before we get started, though, I do want to acknowledge the Home Depot Foundation for their generous support in sponsoring this webinar, in addition to their leadership in our collective mission to end veteran homelessness. Now, members of the military have many aspects of their lives covered or secured by nature of just being in the military. The military provides housing, gainful employment, a daily regimen, food, clothes, and other variables that they don't need to account for on their own. After discharge, however, veterans are quickly left up to take these new responsibilities in their new chapter. That period itself is a critical life transition and can be very challenging or uncertain for many veterans. There are so many major life decisions and questions to answer, like what job opportunities match their aptitudes and support their lifestyle? Where will they live? And what support system will be there when they get back home? While all these are really especially important questions for them, I want the people in our audience to think about how providers can meet those needs at the earliest point of the transition. The inflow of military service members to our network isn't exactly streamlined. Currently, there isn't a national program that automatically connects members of the military to the network of available services unless they seek them out by their own discretion. This naturally creates a service barrier, which could put them at risk of homelessness and induce the negative life outcomes after just finishing their service to their country. If we want veterans to have a seamless transition into their new lives, we need strong systems and tools to help them navigate. These early interventions can have significant implications to strengthen our prevention efforts, which will be a major theme for today. In our discussion, we'll delve into the existing scope of that work, actionable partnership models, and ideas for us to engage with the military population. All that said, I'd like to introduce our wonderful panel, starting with Serg Dickerson. Serg is the president and CEO of the American GI Forum National Veterans Outreach Program, which is headquartered in San Antonio with offices in Austin, Dallas, El Paso, Fort Worth, and Houston. Serg is a 26-year Army veteran serving in leadership positions from platoon to brigade command and with multiple combat tours during his military service. Serg joined the American GI Forum National Veterans Outreach Program in 2015 and served as Executive Vice President and Vice President of Client Services before being selected as President and CEO. In his current role, Mr. Dickerson stewards, promotes, and grows the vision of AGIF and VOP to address the needs of all veterans through community-based programs. Next is Dr. Geraci. Dr. Geraci is retired from the U.S. Army as an infantry lieutenant colonel after serving for 20 years and deploying as a combat leader with elite special operations majors, special operations / ranger, airborne and infantry units to Afghanistan 4 different times since 9/11. While in uniform, he also served as an assistant professor at the U.S. Military Academy in the Department of Behavioral Sciences and Leadership and the Department of Military Instruction. One of his last positions in the U.S. Army was serving as an infantry battalion commander, in which he was directly responsible for the health, welfare, and combat readiness of his soldiers. He received his doctoral degree in clinical psychology from Teachers College at Columbia University. He is an adjunct associate professor at Teachers College, where he teaches military psychology to graduate students and was a co-founder of the college's Resilience Center for Veterans and Families. He serves within the VA VSIN 2 MRECC as a licensed psychologist and director of the VA Transitioning Service Member and Veteran Suicide Prevention Center, otherwise known as TASC. The task is focused on studying and developing interventions that mitigate the significant suicidal risks that our modern warriors face as they attempt to reintegrate back into their civilian communities after military service. Within TASC, he leads 2 national VA programs, the Veteran Cultural Competence Training and the VA Veteran Sponsorship Initiative. And last but not least, we have Brianne Ogilvie. Brianne serves as the Director of VA Policy and Relationships in USAA's Policy and Alliances team. In this role, she drives meaningful policy changes to improve the quality of life for the military and veteran community in support of USAA's National Honor Through Action advocacy campaign. Prior to this role, Brianne served as a senior executive at the Department of Veteran Affairs. She served as the Executive Director, Office of Resolution Management in 2025, Acting Deputy Secretary for Policy and Oversight between 2024 and 2025, Assistant Deputy Undersecretary for Policy and Oversight, and Executive Director of Veterans Benefits Administration's Appeals Program. At the VBA, Brianne led the coordination of enterprise-level initiatives, projects, and procedures that provide veterans and claimants access to disability compensation, education, vocational readiness, employment, transition assistance, insurance, and homeownership. She oversaw services and programs consisting of over 24,000 employees and $154 billion in benefits payments to veterans, service members, their family members, and survivors. That said, I'm going to open up to the presentations, beginning with Serg. Serg, you have the floor. Thank you all.
Wonderful. Good afternoon. I'm Serg. Can you go to the next slide, please? Next one. One before that, please. Just real quick, where we came from. Founder Dr. Garcia, he was a surgeon in World War II, came back and he founded the American GI Forum, which is the shield on the bottom after the picture. That is a membership organization, much like the VFW. And so he founded that in '48. And then after the Vietnam War in 1972, he founded the NVOP, the National Veterans Outreach Program, and that is us. We are the ring around that shield. Just as a distinction, because a lot of folks see AGIF and NVOP as the same thing. We're not. We were birthed by the same founder, but we are 2 separate and distinct 501 organization. Next slide, please. Okay, our mission statement, and I see 3 steps, 3 essential tasks that we consider important to addressing the homeless issue. One is, of course, housing, and then employment, and then mental health. I think those 3 are the platforms to a healthy transition of a veteran to the community that he serves. If you don't do one of those 3 things, you are not going to be successful, and that veteran might recidivize. Now, they may not need all 3, but you need to offer those 3 if you feel, you at least have to be ready to offer those 3 in order to successfully engage that veteran. Because as I see right now, 70% of the veterans coming through my program have some sort of mental health issue. And of course, you can see the variety of different programs, federal, state, even USAA is in there that provides services in San Antonio, where we're headquartered out of. Next slide, please. Currently, we are just in Texas, headquarters again in San Antonio, but we are in every major city in Texas. We serve almost 4,500 veterans. We are one of the largest providers in Texas, if not the largest. And so we do see a lot of veterans, and we have a lot of data to talk about this issue of transitioning service members and why we think it's important. Next slide.
We might be having some connection issues, folks. Just be a little patient. Next slide.
Okay, so again, I'm going to go through these slides pretty quickly, but I just want to give you a taste of what I think the problem is. Right now, we are hyper-focused on the homeless because we have to be, right? They're in crisis. We need to save them. So that's where the engagement is. That's where all the dollars are. And where the dollars are is where we're putting our effort in. And it's clearly the homeless issue. But we're only scratching the surface on the prevention side. We're just not addressing that issue. And there's many reasons for that. My data shows that around 5 years after a veteran transitions, that's where the breakdown happens. They run out of the GI Bill. And for those that you don't know, about 40 to 45% actually graduate using the GI Bill. A lot of the veterans use the GI Bill for the BAH, their basic allowance for housing. So it gives them an opportunity to figure out what they're going to do because they really don't know as they transition out of the military. But when the money runs out and they don't have a degree, they don't have a plan. And maybe they picked up, a felony, or they picked up a drinking habit or something like that. And by the time they come and see me, they have a broken lease and a couple other things that are wrong with them. It's not the same veteran that transitioned at the TAP program 5 years prior. And that's the issue that I want to address. And that's my thinking here is the major problem is a communication. We are not able to communicate with those veterans when they're transitioning out of the military. And then they scatter to the four winds after that. Next slide. Now, TAP is a great tool to communicate and educate the veterans on their benefits. And it's really just a mere orientation on job seeking skills that they need. And that's understandable. In some cases, it's a 5-day program, but I've heard some folks 1 or 2 days and they're through the TAP program. I had the privilege of running those programs at Carlisle when I was the commander there, and at the Benelux when I was a brigade commander there. And what I can tell you is the veterans that are going through that, they're really not sure what they want to do at that point. They really don't have a clear plan of action. And then 6 months later to a year later, for those of you that are not in the military and don't know when the TAP occurs, it doesn't happen the day before they transition out of the military. It could happen a year, 6 months prior, and that's the problem. They're really not engaged in their transitioning until really they get their DD Form 214 and they're out the door. Then they start worrying about it. Why? Because they have missions, they have other things. So again, they're not hyper-focused on what they're going to do when they leave. Some are, but I say many of them are not. I certainly was not. Okay. The TAP occurs 6 months prior, like I said, but what I see the problem here is there's no soft handoff. We always talk about that, when we can't serve a veteran, but we want to help them and we feel another partner that may provide that service. We do that soft handoff. We call the individual and say, hey, I got this veteran and he's going to need legal services. Can you help him? Yes. What time can you see him? Okay, I'm going to bring him over there. That's a soft handoff. That does not occur with veterans. So they leave in a city like, let's say, San Antonio, but they're from Chicago. And they say, you know what, I don't want to go back to Chicago. I don't have much family there, or I don't like my family, whatever the case may be. And I love the weather in San Antonio, so I'm gonna stay in San Antonio. Well, they know nobody in San Antonio. And they think, because they've been told, that they're going to be successful transitioning out of the military because everybody loves veterans, and we do, but that doesn't translate to a job. So even though the TAP serves the purpose, it doesn't connect veterans to jobs. And that's the problem. There's no soft handoff there. But who can do that? Providers can. We know all the employers. If we would see those veterans before they scatter to the four winds, we could connect them with a job. We could put them in housing, but that's not happening. And then the result at the tail end of that can be tragic. My personal feelings on this, as you go down the list, is suicide. you know, many of us in the military have experienced combat, and that affects everybody differently. And I don't claim to be an expert on, you know, the brain and how that works. But I will tell you that I don't believe that combat experience or combat in and of itself leads to suicide. I think lack of purpose does. And I think when veterans transition out of the military and they don't get that purpose pretty quickly, they start wondering, why am I still alive? At least some of them do. And then, of course, the combat experience heightens that belief. And some of them tragically kill themselves. So if we're really going to address that problem, prevention has to be part of that discussion. Next slide, please. On the left, on the green, support is easy. The veteran is motivated. He has no priors. He has no broken leases. You know, he's looking forward to transitioning. You know, that's the guy or gal that you want to place into employment. Okay. The veteran on the right that has all these problems are the ones you have to place into employment and housing and provide mental health for. But they're not the ideal person. And you know what I mean. Are we going to help them? Do we have to help them? Absolutely. But why are we waiting till they get to that point to help them? You know, it just seems to me a reactive approach to a problem, not a proactive one, you know? So when, and I like to use, you know, diseases as an example. You know, we talk about scarlet fever or tuberculosis or all of the, you know, bubonic plague. And we talk about, you know, we gave a vaccine for those and we don't have those problems in the modern world anymore. Why? Because we vaccinated them up front when they were children, right? Because treating the infection, treating the disease on the tail end of it always leads to death or almost, you know, it's bad. And I'm exaggerating here, but my point is, why can't we be proactive about this problem? Next slide, please. So I kind of see the problem as a dam. We have to address the homeless flow rate. The current approach is replete with difficulty. We basically address the issue at the tail end. We have to, okay? But it's not a deterrent for those coming in that are homeless. So even though we're taking homeless off the system, we're adding more homeless because we're allowing them to come into the program. So we're never truly ending the problem. We're just diminishing it 1 year and then it goes up during, you know, the wars. And as, you know, the Army scales down in numbers, then you have more homeless and then it goes down and it goes up. But we really don't address the problem in an effective way because we're not addressing it at the beginning. We're not stemming that flow rate. Next slide. So how about early intervention at the tap or shortly after, preventing homelessness in the first place? Because really, you know, not doing that, the old way, the reactive approach is very difficult to do. And it doesn't always end up successful because they end up recidivizing and coming back for all the reasons that are on that slide. Next slide. And let's go to the next slide. So the old way is on the top. We focus on the tail end of that spectrum, okay? Because we have to. I mean, we have to focus on the tail end no matter what. but that's really the only place we're focused on. Why? Because of communication. We have no access to the veterans as they're transitioning out of the military. We can go to the TAP, but that's not their last day. Their last day is when they get their DD Form 214. And are you really talking to them then? No. They're going all over the United States or even abroad, and maybe going back to the state where they live, you know? And so we're not able to affect their transition in a meaningful way. The new way, I would suspect, is the one on the bottom, where we address the veteran at the front end on the prevention and on the back end. That's how we eradicate homelessness. The old way is never going to work. And we've been doing this for 15 years, and we've cut it in half, but we've poured a lot of money into it and we haven't ended it. So I would propose that the way to end it is to attack it at both ends. But to do that, next slide, we need a nationwide transition program. We need cooperation from DOW. We need cooperation, local cooperation from the states, city governments. We need those veterans to talk to us at some point. If they're not going to affect that soft handoff, then give us their information so we can contact them 6 months before they're going to transition. You know, many of us have federal contracts. So, and then those contracts need to be such that we can help transitioning service members, because many of them are written for homeless veterans. And let me give you an example. What's a veteran, what's an E4 that leaves the barracks, right? Lives in a barracks, leaves the barracks, and then loses his pay and is now out. It's the definition of homelessness. They don't feel that way. They go live with mama or they go live with a friend, but in effect, they have no place to live and they have no salary. So why do they not qualify for SSVF, Supportive Services for Veteran Families, or HVRP? And in some cases they do, okay? Because those grants have changed to some extent to compensate for that transitioning service member. But it needs to be more specific for transitioning service members so that we can use the full spectrum of those supporting grants, right? The goal here is the veteran is housed and employed post-transition within the first 3 or 4 weeks. That's the goal. You want to see veteran suicide go down? Try that approach. You might see that go down significantly. I'm willing to bet my salary on it. And that's all I have. Thank you very much.
Great. Thank you, Serg. All right, Dr. Geraci, you're up.
Awesome. Serg, I really appreciate your continued service to our country and our veterans, and I couldn't agree more with everything that you stated from a preventative approach, personalized approach, early activation. So I'm really excited to kind of share some of the things that we've attempted to do to exactly get after exactly what you're mentioning. So we've been at this work for about 10 years. So Dr. Joe Geraci, so MA, as mentioned earlier, a psychologist in the VA, 20 years of serving as an infantryman. So now the honor to be the principal investigator and lead for the VA Veteran Sponsorship Initiative, and then also a close collaborator. We expanded our National Virtual Care Clinic for transitioning veterans. Next slide, please. Kind of Serg mentioned the concerns with suicide. I know a lot of the focus here is on homelessness. So I am a suicide prevention researcher, implementation scientist. So I'll kind of talk to the lens of suicide, but as Serg was talking about, so homelessness left unaddressed can lead to and can be intertwined with suicide ideation and thought. So a lot of this stuff I do talk about suicide here, but very much can be related to homelessness. And I will talk about some of the predictive analytics modeling that we have published specific to homelessness. So here's just some of the stats from one of the most recent annual suicide reports On the bottom right, you can see the slide for those the trajectory for those 18 to 34-year-olds within the first year after they get out. So we've seen a doubling of their rate of suicide within the last 10 years. About 200,000 of them transition every year. Service members, that is, transition every year, with over 80% of them being 18 to 34 years old. So that red line is a problem for the VA. It's a problem for our country. About 1% or 2,000 of these transition service members have a suicide attempt within the first year, and only about 25 to 30% of them actually engage in VA care. So a term that we've kind of dubbed in a lot of our peer-reviewed journal articles is the deadly gap, is to kind of identify and capture this problem set of so many service members that are having a suicide attempt or having a suicide death within the first year after they get out, and they're not engaging in VA care. So this is a problem set that we've been working on for about 10 years, and really excited to share with you some of our progress. Next slide, please. And so one of the things we've started looking at is the predictive analytics modeling. So there's a really large study called within the Department of War called the STAR study to assess risk and resilience among service members. And a lot of that work is tracked over 2 million active duty service members while they're in service and as they transition to civilian life. So having access to 50 Department of War databases for these individuals has allowed the team that we work with at Harvard Medical School and Department of War Uniformed Service University, where the STAR study resides, to pretty accurately to identify the predictive analytics modeling models that allow us to predict these outcomes. So here's just one example. So within, I'll talk to you about the VA Veteran Sponsorship Initiative. We have, that represents about 400 service members, about 400 service members per week that enroll into our initiative, within the active duty military. And prior to us leveraging the predictive analytics modeling, it was a needle in a haystack approach to where's the suicide attempt. Again, about 1% of the population will have a suicide attempt. If we're doing about 400 per week, then where are the 4 amongst those service members we've enrolled where we're going to have that suicide attempt? And without an ability to really kind of to do a predictive analytics approach, we're providing universal services. And if we're providing universal services to everyone, we're not really providing services to anyone. So this is a problem set that we were in when we first start the initiative. Next slide, please. And on the next slide, we'll kind of talk through our approach in one of the papers that we published in 2023 with a model that allows us to predict suicide attempt in the first year after. So on the right side, you can see here, if we're doing the risk modeling in that the model that we published, this is a STARS practical risk calculator for suicide behavior, we can predict who's going to have a suicide attempt in the first year after they get out. So within our top 30% of risk, as it states there, within the top 30% of risk on our risk modeling, our predictive analytics modeling, account for 93% of the suicide attempts within the first year after. And I'm not a betting man, but if I was, that's a bet I would take every time. If I can isolate the winners, or in this case, those that die by suicide, to the top 30%, and we're going to capture 93% of them, that's a really great stat. And I think these statistics and these modelings we've been able to build has really allowed us to revolutionize this entire transition space. So this is enrollment while they're still in the military. We apply the predictive analytics modeling, and then being able to kind of isolate our treatments and our interventions and our services truly to those that need them prior to military discharge. And as Serg talked about, them throughout their entire lifespan. Next slide, please. So the initiative that we created is the VA Veteran Sponsorship Initiative, and it has a couple key components. So enrollment on Department of War installations, Serg talked about the criticality of that. We apply the predictive analytics modeling, and one thing I didn't mention is we now have models that we published in JAMA and also Nature Mental Health and a lot of other top-tier journal articles where we're also able to predict suicide death and apropos here to this conversation, homelessness. So we can predict pretty accurately now who is going to be homeless among this population within the first year after they get out of the military. And then for those that are within our top risk stratification modeling, then we provide them the interventions. So the interventions we have available are a volunteer peer sponsor that we've certified in the VA, but as part of official partnership we have with the VA, an organization called Onward Ops, to manage them with about thousands of sponsors around the country, every county across the United States, get them seamlessly connected to VA care. And I'll talk about the National Virtual Care Clinic we created, and then to be able to do the evaluation. So I'm the principal evaluator and principal investigator for about $30 million worth of evaluation that's been invested to evaluate this process. And our first randomized controlled trial results, you can see we published in Military Psychology in 2023 in the bottom right. Next slide, please. So when I want to kind of talk about the most important thing is Serg really hit the nail on the head, is the enrollment on the installations. So you can kind of see here a map of the United States, where majority of the 18 to 34-year-olds, those 25 years old, are where they go. And darker the brown, the more going to there. So we started working with a lot of these states and a lot of these installations. And if you wouldn't mind just building a slide for about 3 pushes, it'll build out kind of the different enrollments that we're doing. So as Serg talked about, we're enrolling on the military installations, and one more, and then I'll let it go. We're probably going to go to the next slide. That's fine. So everybody gets the idea here, is that we started with 3rd Armor Corps installations in the Army, and that allowed us to enroll about 20,000 per year. And then we started enrolling on 18th Airborne Corps. So right now we're enrolling on the Army's 8 largest installations. I currently located at Fort Campbell, Fort Campbell, Kentucky. I'm sorry. I was at Fort Hood, Texas on Monday. And then Camp Lejeune, you can see I was at Camp Lejeune on yesterday, initiate this process. So these installations, it's part of their transition process. It's required for them to come and meet with our team. They have an opportunity to learn about the VA Veteran Sponsorship Initiative with our partners, Onward Ops, to enroll in the initiative. They sign up and they do the predictive analytics modeling. And our goal is that we will be enrolling all 200,000 that transition annually. So give us about 2.5 years. Due to the great support, individuals like USAA, Face the Fight. I know Brianne's going to talk about that next. I think that's achievable. Right now, we're enrolling 70% of the entire Army, about 45,000 per year. And our goal is to get to all 200,000. Yeah, that's great. Next slide. And then here's where, as Serg talked about, the criticality of connecting them to the communities. On the next slide, we kind of talk about where are these 40,000 we've enrolled over the next 2 years, where they've gone. And you can see the concentration of the states. So we're doing Fort Bragg and Fort Bliss in Texas. So you can see that's taken us to almost 8,000 over the last 2 years. We've enrolled, and then connect them to the community partners within those states. And as we start enrolling the 18th Airborne Corps installations on the East Coast, states like North Carolina, South Carolina, Georgia, Virginia, Florida are going to pretty rapidly going to increase in numbers. And so we, as you can see here, we've got service members going to every state, to every county, and us to kind of work and to pair them with the peer sponsors to help them to get them VA care early while they're still in the military is key and critical, not only to mitigate suicide risk, but also homelessness. Next slide, please. So I'm just going to spend about a minute talking through our National Virtual Care Clinic. So 40,000 in the program over the last 2 years, apply the predictive analytics modeling. Really challenging for us to connect them all seamlessly to 180 different VA medical centers around the country, different interpretations on availability or registration, enrollment. So what we did is we worked with the Office of Primary Care and developed a National Virtual Care Clinic. And so we're able to leverage VA providers all around the country, created 5 different hubs. And within 5 days, like hold me to it, we can get those in our top 30% into a virtual primary care appointment within 5 days of them getting out, get them connected to mental health care, case management care, and especially this population that experienced lots of musculoskeletal pain. So created also a virtual physical therapy clinic within this clinic. So there's our pilot results in the top right that we published a couple of years ago to kind of show the viability of this. In next slide. And then on the next slide, my last slide here, we're going to talk about our results. So as Serg talked about betting his pay on the results, seeing a significant reduction in suicide. Next slide, please. So this is a study we just published a couple months ago. And on this, on the left side, you can see that we significantly increased those access to care As mentioned, only about 30% service members seek VA care within the first year after. We did our comparison group. That's about what we found, a transition as usual group. But those that went through our intervention connected to care, we had a significant increase to 53%. And this data is from 2024. So our current data, we're over 70% getting them connected to care. And on the right side, you can see really importantly that we saw a reduction in suicide attempts. So again, about 1% of the population will have a suicide attempt in the first year. So we collected this data about 10 months after they got out of the military. So that's where we saw the 0.92%. If we had gone the extra 2 months, we would have seen the percent of suicide attempts go over 1% in our transition as usual group. And you can see here within those that went through the intervention, had access to all the services and benefits that VSI offers with our Onward Ops partner. We reduced that to 0%. So 0 suicide attempts is what we saw amongst the population. And importantly, when we look at that 1% of suicide attempts within the transition as usual group, we were able to predict pretty accurately those suicide attempts. But they were in our transition as usual group. And as a scientist, that's the type of stuff that keeps me up at night. But that's why we do science, to kind of show the evidence basis in it. And so now we're really excited to expand and share this work with partners. And our goal, again, is to enroll all 200,000, apply the predictive analytics modeling, get them seamlessly connected to their partners, the community. We have a meeting tomorrow with 21 secretaries across 21 states to sign MOUs so that our public-private partner, Onward Ops, with the support of the Office of Suicide Prevention, the support of USAA Face the Fight, can provide this data seamlessly to the states and to the partners in the VA. We can get them connected to the care. So really appreciate your time. So just staying on schedule here. I'll yield the floor to facilitate Brianne, provide her phenomenal remarks. So thank you.
Thank you, Dr. Tracy. All right, Brianne.
Good afternoon, everyone. So next slide, please. So in November of last year, USAA launched Honor Through Action, which is a movement to turn our gratitude for the military community into meaningful, measurable actions that improve the lives of service members, veterans, and their families. So our vision is to mobilize the public and private sectors to drive policy change, create opportunities, and improve the quality of life for the military community. This is bigger than philanthropy, which has always been a part of USAA's business. It's more about using the tools we have, so our voice, our expertise, our partnerships, our resources, and our influence to help remove barriers. We want to create a future where a service member transitioning out of the military can see a clear path to a meaningful career, a financially secure future, and a healthy and connected life. So we've grounded Honor Through Action around 3 pillars. The first is meaningful careers. For many service members, transition is much more than landing a new job. It's about translating years of leadership, technical expertise, problem solving, mission experience into opportunity in the civilian world. We need employers to get better at recognizing the value of military experience. And we also need to think about the military spouse. A military career should not come at the expense of a spouse's career, and it often does. So we're looking to expand employment opportunities, improve credential and licensing portability, and help employers understand how to effectively recruit, hire, and retain military-connected talent. So the second pillar is financial security, and financial security is really foundational to everything else. So a financial shock can quickly become a housing crisis, a family crisis, and/or a health and well-being crisis. And we want to help military families build financial resilience upstream, not just respond when they are already in crisis. So that means helping families understand the financial implications of transition, increasing access to financial education and resources, and creating pathways to long-term financial stability. So we should also be thinking about the moments of greatest vulnerability, as most of military life and beyond is a series of transitions: entering military service, moving, separating or retiring, transitioning to civilian life, experiencing a financial setback, or facing a major life challenge. Our goal is to help ensure that military families have the tools and resources to move from financial uncertainty to a secure financial future. So the third pillar is well-being, and we want to make it easier for service members and veterans to access the right support at the right time, especially during periods of transition. We also recognize that well-being doesn't belong solely to the healthcare system. Communities, employers, families, schools, nonprofits, and peers, they all have a role to play. And sometimes the most important intervention is simply making sure someone knows where to turn and that someone is there to help them navigate, like Dr. Geraci was talking about. That's why partnerships and coordinated systems of support are so important. So we're at USAA, we're turning our priorities into action through several levers. Historically, we've targeted philanthropy and business integration, but as part of Honor Through Action, we've added a policy transformation for enduring change, which is the team I'm part of, and partnerships with corporate alliances to extend our reach and impact. And then ultimately, Honor Through Action has to be about outcomes, not activities. So we're measuring our successes through several measurements, including starting our own comprehensive measurement system that ultimately asks, are the lives of those in the military and veteran community actually getting better? So we want to measure success through lives impacted, capital mobilized, policy proof points, member sentiment, and the long-term movement towards a higher quality of life for the military community. Next slide, please. So as mentioned on the previous slide, under Honor Through Action, we developed a 360-degree approach transformation using several levers to influence change. And I quickly touched on these before, but I'll just quickly touch on a couple things in addition. So for our targeted and innovative philanthropy, we want our philanthropic investments to do more than address present problems. We want to test what works, learn from it, and then scale those solutions so we can have lasting impact. That means being willing to support innovative ideas, take calculated risks, and focus our resources where they can make the greatest difference. Policy transformation. Some of the biggest barriers facing the military community require changes in policy, systems, and processes. So USAA, in coordination with community partners, is identifying structural barriers and working alongside policymakers, military leaders, states, communities, and other organizations to remove those barriers. We also want to identify opportunities for positive change and ensure those changes last by integrating them into policy. As for business integration, as a company serving the military community, we also have an opportunity to use our own business capabilities to create impact. So we're asking ourselves, like, how can our products, our services, our expertise, and people help solve problems facing the military community? Social impact is something that is embedded in how we serve our members and how we engage with the broader military community. And finally, under corporate alliances, we recognize that no organization has all the answers or the reach necessary to solve the challenges. So part of Honor Through Action is bringing in other large influential corporations, as they also have a role to play. We're currently in the early stages of working together on challenges aligned under each pillar to put our collective resources and innovations behind them. Next slide. So as part of the policy and alliances team, I want to share a few of our focus areas in the policy space. Sorry, I'm just talking to the slides as they're changing over just to save time. The first is the transform transition support, and that's the one that's most important to today's panel. So under this line of effort, we want to build a more proactive, personalized transition experience that connects service members and families to the right resources, employment, financial readiness, mental health, housing, and community support before challenges become a crisis. And we want to shift transition from a point-in-time event to a sustained journey, as both of my other esteemed panelists were talking about. With coordinated support, we want to make sure that support extends to that critical first year after separation and measurable outcomes so we can measure stability, employment, and well-being. So our remaining lines of effort mostly focus on the currently serving community, but I'll quickly touch on them. We're also focusing on making PCS, so personal change of station, less disruptive to military families by improving coordination across several areas before, during, and after a move. And we're leveraging public-private partnerships and technology to make a more seamless PCS experience, helping families maintain financial and personal stability through repeated moves. Military spouse employment and career opportunities, we're advocating to expand portable career opportunities for military spouses through remote work or licensing portability, skills translation, and career coaching, and connecting them to employers who understand the realities of military life. And then finally, our high impact quality of life needs, we're focusing our efforts and resources on the issues that most affect family stability, including affordable housing, childcare, food security, and access to essential services. Next slide, please. So a few of our initiatives are noted here. I'll get into the financial security ones in more depth on a subsequent slide, but I want to highlight well-being, especially since it's relevant to our topic of transition today. Face the Fight, which was founded by USAA, Reach Resilience, and the Humana Foundation, is a suicide prevention life-saving initiative. It brings together more than 250 cross-sector partners with a goal to dramatically reduce veteran suicide by 2032. Honor Through Action builds upon that and expands the efforts of Face the Fight, especially in the well-being pillar, in providing veteran suicide during military to veteran transition, where the suicide risk significantly increases. Both Onward Ops and VA are Face the Fight coalition members, and Face the Fight and USAA have provided grant making to Onward Ops for several years. As part of our broader grant making process, we're always looking to see what's working and what's not. And we track this to ensure that our grant recipients are delivering on outcomes, and we're continuing to invest in the best opportunities for the military and the veteran community. So USAA and Face the Fight have seen outstanding results in drastically reducing suicide attempts for transitioning service members from the VSI Onward Op pilots with the Army, as Dr. Geraci was talking about. As part of our efforts in Honor Through Action, we've amplified this program and brought it to some of the highest levels within the VA, Department of War and Military Services to directly integrate it into the transition process. Next slide, please. So getting into some of the root causes of homelessness. So veteran homelessness often starts much earlier with financial instability. So unaffordable housing, financial shocks, transition challenges, or damaged credit. Honor Through Action is designed to intervene upstream before that financial stress becomes a crisis. So we're looking at the 5 root causes of financial instability to position our impact and mitigate those drivers. So the first one is housing affordability. Housing is the #1 pressure point. High rent, home prices, insurance, and disaster costs, they leave little financial margin. So falling behind on housing can quickly become an instability issue. The second one is cost of living. Food, transportation, utilities, childcare, and insurance continue to stretch the military and veteran households. When there's no financial cushion, one unexpected expense becomes a crisis. The third one is military financial shocks. So PCS moves, deployments, mobilizations, spouse job loss, and guard and reserve income changes create recurring financial disruption. And those repeated shocks are often found in the military, which make it harder to build that savings and that cushion that you need. The fourth one is military to civilian transition. So leaving service can mean simultaneous changes in income, benefits, employment, housing, and community in the first 24 months especially are a critical prevention window. And the fifth one is credit challenges. So financial instability compounds itself. Financial shocks, they damage credit, and weaker credit then makes everything more expensive. And so the goal here is identifying financial distress early and intervening before it becomes a housing or a mental health crisis. Next slide. So we're tackling these root causes of homelessness by helping military families build financial security both before and after transition. So we've established financial relief and education programs with key partners to target impact on currently serving military families, especially E6 and below households in high-cost locations. So these organizations provide financial relief and education channels, financial wellness counseling, and case management that can help families stabilize and build better financial behaviors. This support mitigates immediate financial pressure while also building the knowledge and confidence to move forward. So disaster resiliency expansion, that strengthens disaster mitigation, response, and recovery for military families and high-risk, high-insurance cost communities through 3 of the partners listed here. And it's designed to help families prepare before disasters so they can recover faster after disasters, and they can rebuild stronger during recovery, and it reduces the physical and financial damage that financially destabilizes a household. So moving to after transition, we're working with Warrior Secure, or Wounded Warrior Project on a program called Warrior Secure Start. So it's built on Wounded Warrior Project's proven financial readiness program, and it's supported by USAA's Educational Foundation's course curriculum. And this model delivers rapid stabilization, education, and reinforced financial behavioral coaching while offering established pathways to career and well-being services. So this initiative targets the impact of acute financial instability from unemployment, income volatility, benefit delays, and rising debt and housing strain. And then finally, the Financial Resiliency Program with U.S. Vets. This will operate across U.S. Vets residential programs, community-based service centers, and homelessness prevention-focused Veterans Connection Hubs. So rather than treating housing and financial stability as separate challenges, U.S. Vets will provide an on-site financial counselors to help veterans with budgeting, rent planning, credit repair, and transition planning. And veterans will receive home-based case management, benefit screening, job training, and one-on-one financial coaching. Next slide, please. And then finally, since this is my last slide, so since we're talking about interventions for transition, I wanted to touch on things that we're seeing that are working through proven results. So we've covered several of these already throughout the discussion, but there's a few I want to highlight. We're seeing through many partnerships, including with Onward Ops and VSI, that the best practice of building continuity across transition through warm handovers and community integrations really works. When we meet veterans where they are and have the time and resources to personalize the transition experience to their needs, it makes a significant difference in successful outcomes. Also, where possible, using longitudinal measurements of outcomes, so measuring an experience across multiple points in time, that's extremely helpful to learning what's working and what's not. So ultimately, successful transition requires coordination, early engagement, and strong partnerships across the public and private sectors. And it will last for several years as new veterans navigate ever-changing challenges that last for several years post-transition. I'll turn it back over to Jay.
All right. Oh, rookie mistake. My camera, for some reason, that work? All right, cool. All right, can I have all the panelists show back up on camera to start our Q&A portion for the remainder of our webinar? So for the first question, this goes to Dr. Geraci. Regarding the VSI program, what are some of the lessons that you've learned about the VSI model that could reshape the way we think about homelessness prevention?
Yeah, and amongst family here, right? We got how many hundreds of family members here in the room, and I'm very open and transparent. Number one is that people inevitably resist change, and change is really, really, really hard. That there can be reasons to be kind of stuck in the status quo because somebody might be benefiting from it. So what we have learned through VSI is that it has been a very much uphill climb, an upstream swim to accomplish this, and it has really taken us to galvanize the support with strong partners. Like early advocates and early wins have been key and critical. So that is the number one thing that I have learned through that. How can this be applied to the homeless, and maybe not specifically related to that, but early intervention is key and critical, as Serg was talking about. Like, I have no doubt that that the suicide attempts that we've reduced, once we are doing assessments for homelessness, we just haven't published the data yet, that we also see comparable approaches to homelessness. These negative outcome behaviors, that they can be prevented with a lot of the components that Brianne talked about. The predictive analytics might identify those at risk, early interventions, a human being that's engaged and involved, that's connected to that individual. So I'm going to guide you through this process is key and critical. And connected to the community partners is really important. So thanks for the question.
Yep, thank you. Going to Serg, this is a question from our audience that I wanted to know a little bit more about your program at AGIF and VOP. So this person's question is asking, what specialized training and resources does your team of case managers have to support veterans who are not the typically recently discharged housing ready veteran? And how do you prevent these veterans from being turned away because of the complexity of their needs?
Thank you for the question, Jay. So, we have case managers, we have housing managers, and then we have counselors, mental health counselors. So what we do is we have a clearinghouse where we have all of those folks in the same building. Because a lot of times when the veterans come off the streets, they don't want to be sent to another building or another facility somewhere else. They want to be seen in one location and all their problems handled. And they will go to the facility that will provide that kind of service. So oftentimes, we don't provide legal services, so we'll bring in a team of attorneys that service veterans for free. We'll bring in the Bexar County disability person that does disability claims for veterans. We'll bring in the Medicare folks that sign folks up for Medicaid, Medicare after they turn 65. In addition to the mental health, the housing services, and other case management services. So that piece helps. The second thing is we make sure we know all our community members. So if we can't help them, we do a soft handoff to that individual that can. And soft handoff meaning we call that individual, bring the veteran to them, and solve that problem with the other community member. And oftentimes what that results in is those individuals bringing those veterans to us when they can't resolve the problem. That way, no veteran is left unattended. There are many veterans out there and there are many providers out there. There's no reason to do things on your own or feel you're not going to meet your numbers or whatever, if you let your veteran go here or there. The truth is, your biggest advocacy for having veterans come to you is word of mouth. If you treat that veteran with respect and dignity, they will remember, they'll tell 5 or 10 others, and those folks will come to your organization. So we feel that, providing exemplary service to them is great. One other thing I'll answer, we talked about the difficulty of these veterans. We have several stages of housing for them. So in addition to the mental health that we usually address once they come in, we have transitional housing through the VA, and then which is called the Grant Per Diem, and we also have permanent supportive housing through HUD, and we have SSVF supportive housing for veterans and families. So we take them through a period of transition. We don't feel that if you've been out in the streets for many years or you've been in crisis for many years that you're ready to go to housing. You need to be kind of brought back to the fold, and we usually have a storm and norm time of about 10 days where the veteran comes in, we put low demands on them, and sometimes they break stuff, sometimes they scream at the staff, but we do nothing with that veteran. We keep them housed no matter what. Unless they strike a staff member, we keep them housed. And usually by the 10th day, that veteran is calm and they feel safe again and they're fed. Their mental health has been addressed. And now you can address issues like, employment, mental health. They're easier to handle. So we have that 10-day period that I will not allow any veteran to be kicked down the streets because they're not dealing well with the staff. We go through that period and that helps. So that's for our very difficult veterans. For those that are transitioning out of the military, for example, we have a program that's working really well with the Air Force Base at Lackland. It's called the DRIVE program. It's not with all their airmen that leave the military, but it's the ones that are problematic, that are leaving because they have, physical issues or maybe they got in trouble, etc. And every one of those veterans come to us. They work with us directly. Not one of those veterans has been homeless or on the street for any period of time. We've had 100% success rate. So again, if we see those veterans before they hit the streets, I can 90%, I can ensure that they are housed and helped adequately. But if we don't see those veterans, we don't know they exist, we can't help them. And if they come to us late, then the outcome of those veterans that come to us late is not something that we can control all the time, So again, sorry, it's a long answer to a very, very good question. Thank you.
Thank you, Serg. We'll do a couple more questions. We have a lot from our audience flooding in right now. Brianne, I have a question for you. So USAA places a lot of emphasis on coordinated efforts and partnership across the country. I'm curious to know, what role can the service provider population play to support USAA's work in this field?
Yeah, thanks, Jay. So providers are super critical because they see gaps before anyone else does, because they're like on the ground doing the work. They'll interact with a transitioning service member or a veteran when they're facing employment, housing, financial, or family challenges. And that gives providers a unique ability to identify that risk early. So as I mentioned earlier, I think we need to move from a referral model to a warm handoff model, which I think is the soft handover or whatever Serg was calling it. It's similar. So I think we've seen from providers that providing a list of references or just giving someone a phone number or website just isn't enough. And that's a lot of what veterans are finding online. That warm handoff model is really what's working, though, in practice. They are also incredibly valuable as a feedback loop. So those providers that are regularly seeing veterans struggle with housing or with employment or transportation, benefits navigation, that's really important information to share with the broader ecosystem. So I think that the provider community is critical. You'll see the veteran when a transition challenge becomes an actual crisis, or hopefully before that. And the opportunity is there to make sure that those providers don't have to solve that problem alone, and that they have a connected network that can activate around the veteran that they can tap into.
Thank you, Brianne. I have an open question to our panel. This person asks, what advice would you give frontline staff who are assisting veterans during the first year after separation from service? Dr. Geraci, you look like you want to say something.
So, especially if it's somebody that doesn't have a lot of experience with veterans, I would recommend they attend veteran cultural competence training. So, for example, there's a national training we run through the VA just to kind of help new providers to best engage with the service members that are transitioning to veterans, to kind of help them meet them where they are. And really to kind of help to develop empathy, genuineness, and unconditioned positive regard, some Carl Rogerian type things with them. So just making sure that you're culturally competent in regards to helping that population. A lot of times I try and train new providers. It's like, okay, put your manual away and put your human being hat on and help this individual in a meaningful, important way. So that's probably the biggest thing I would say.
I would add that there's a lot of opportunities to connect with those separating service members in that first year, to check on them on several increments. So VA has the Solid Start program where they call veterans 3 times a year in that first year post separation, and they check on them to see how it's going. And I think that concept is really something that providers can use as well. And they probably have more time and resources and personalized expertise to be able to really take the next step to do warm handovers to the other providers who may be able to assist them with some of their issues. But the problems that some who are separating, or challenges that some of them are separating, are experiencing in the first 30 days are so different than what's happening maybe at 1 year post separation. And things could be great at the first 30 days, or it could be the opposite. But 1 year later, they could feel like they've been at a job that really isn't the right match for them. It isn't really meeting what their desire to give back, or they're just not feeling fulfilled. Their family might be struggling. So there's just things change over time, and even in that first year, and that's such a critical time. As we've been talking about, it's referred to the deli gap for a reason, because it really is such a critical time, a loss of identity for many people, and just checking in with them at different stages, to just, even veterans who are saying, I'm doing fine in the first 30 days, just may not be there, 6, 8, 9 months later.
Thank you, Brianne. Serg, do you have any thoughts on that?
Yeah, absolutely. I would recommend that you develop a relationship on the base with your TAP personnel, and then those guys are going to get a lot of veterans that transition out of the military and come back to the TAP to try to get some help. The retirement officer also, because they're the ones that are going to give them that DD Form 214 before they leave, might be the last person that they see. Give them your contact information, develop that relationship, maybe even have an office on base if you can afford to, because then as those veterans are leaving, they're going to see your face. They're going to ask, hey, can I get employment, whatever. And then that's going to be your connection to that veteran. You need to be somewhere where you can be seen and you can help, because once they leave the base, you don't know where they're going to go. And if you have federal programs like I do, and most of you do, you can reach out to any state they're going from that point, and reach out to SSVF and, in Colorado or in California or anywhere they're going, and help them in that regard. So better than they go there and not have any support, you can be that connection to a successful transition in the community that they serve.
Thank you, Serg. That'll close out our Q&A for the webinar. Thank you all so much for staying the extra minutes. First, I want to thank our panelists, though, for sharing such important insights on interventions during the transition period. I feel like this really contributes to the discourse surrounding homelessness prevention amongst veterans. Serg, like you mentioned earlier, the flow rate is a really important lens to look at when addressing this issue. Creating a proactive system can have a significant impact on both homelessness and suicide ideation. So we can't wait until a veteran is experiencing homelessness before we offer support. We should be identifying housing risks, employment barriers, gaps in benefits, and other challenges before this becomes a crisis. Ultimately, a successful transition model builds upon a foundation for a stable life, one that includes safe and affordable housing, meaningful employment, financial security, and a community of support. That said, again, I just want to thank our audience for attending this session, and of course, a huge thank you for the Home Depot Foundation for their support for this webinar. That concludes the webinar on supporting military service members during the transition period. We do have another webinar coming up on September 23rd. That'll focus on how we can support veterans exiting incarceration. So keep an eye out on your email as the registration links will be sent out to you all. And again, slides and video will go out to the email that you registered, and we'll also upload it to our YouTube channel. We'll also have a record of the Q&A in that email. So again, thank you all, and have a good rest of your day.
Thank you.